My name is Dr. Howard Liu. I'm a child and adolescent psychiatrist. I also see adult patients. I've been practicing in 3 different states. One is Massachusetts, one's in Michigan, and in Nebraska now for several years. So when I work with youth, there's teens and kids, I like to sit down with the whole family together. And I usually ask them about who they are as a person first before I ask them why they're here. I ask them to tell them about the family, tell them about their hobbies, what they're passionate about, tell me about their friends. And I try to get to know them as a whole person before we get into the mental health issue. There's a lot of pressure right now on people who are young adults and kids and teens, from social media to the pandemic to other issues. And so really it's a chance for us to help them out, to really get to the root of what the issue is. And many of them have been struggling for years in silence. So it's a chance to really just address their depression, their anxiety, ADHD, whatever's been troubling them. And oftentimes it's a great relief when they finally get treatment. I chose psychiatry kind of by accident. It was my last rotation in med school, and I spent it at the VA hospital and really had an outstanding experience working with veterans with substance use disorders, and really loved the experience, loved hearing their stories, and knew it was the right field for me. So I'm actually a second-generation Midwesterner. I grew up in Iowa, and my father actually practiced pulmonology and sleep medicine in Iowa. So what I really like here is that it feels like home for me. I like working with people who are passionate about interfacing with the community. And I really feel like we can make a difference because everyone's just a phone call away, very relatable. Academic medicine's really been a great fit for me. I enjoy working on teams that are interprofessional and diverse to improve patient care. And we've demonstrated that in a couple ways in the Department of Psychiatry. One is by opening up a new psychiatric emergency services, which has really been helpful for people in crisis. Also working with youth at risk at North Omaha and many other projects. And that's what I really find a lot of value in, is the community ties.